Last, we will talk about the lymph nodes in the axillary region. The axillary lymph nodes drain lymph vessels from lateral quadrant of the breast, superficial lymph vessels from thoraco-abdominal walls, and vessels from upper limb. This shows how important the lymph groups are in the axillary region. The lymph nodes are arranged in 5 groups. Lymph nodes draining the upper limb lie mainly in the axilla. Some of them we have talked about when we studied anatomy of the breast. Let's go through them once again. Anterior or pectoral group of lymph nodes lies along the lateral thoracic vessels along the lower border of the pectoralis minor. They drain lymph from lateral quadrant of the breast and superficial vessels from anterolateral abdominal wall. Posterior or the subscapular group of lymph nodes. As the name indicates, these nodes lie in front of the subscapularis muscles. You can also remember that they lie along the course of the subscapular vessels. They receive superficial lymph vessels from the back. As for the lateral group of axillary lymph nodes, they are present at the medial side of the axillary vein and lie along the axillary vein. They receive lymph from the upper limb. Central group of axillary lymph nodes. Present at the center of the axilla, they receive lymph from the 3 groups mentioned before that is anterior, posterior, and lateral group. Lastly, we have the apical group of axillary lymph nodes. These nodes are present at the apex of the axilla, just lateral to the first rib. They receive lymph from other axillary lymph nodes. The areas of drainage of these groups here. The anterior group of axillary lymph nodes receive lymph from skin and muscles of the anterior and lateral walls of the trunk, and from part of the mammary gland drain to the anterior group. The posterior group of axillary lymph nodes receive lymph from skin and muscles of the back of the trunk. Almost all the lymph from the upper limb drains into the lateral group. The lymph from here moves to the central and then the apical group of lymph nodes. A few vessels go directly to the apical group. At the end, the subclavian lymphatic trunk arises from the apical group and conveys the lymph to the thoracic duct, or to the right lymphatic duct through which it reaches the bloodstream. That concludes our video on the axillary region in the upper limb. Stay tuned to sqadia.com to watch our upcoming videos in our upper limb series.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.